Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we hope to highlight key global health issues, celebrate unsung heroes, and inspire the next generation of public health practitioners. Today, we are collaborating with Eastern Virginia Medical School, School of Health Professions, and I'm delighted to welcome Dr. Robert Campbell. Dr. Campbell, welcome to today's episode.
Thank you. Thank you. Hi, I'm Dr. Robert Campbell, Jr. I'm the assistant professor, the school of, I shouldn't say the school, but the Master's in Public Health program at Eastern Virginia Medical School. I am honored to have our special guest speaker, Dr. Monique Foster, with us today. Okay. Public health in real life is an initiative to educate people, celebrate unsung heroes, and inspire the next generation of public health students, professionals, and leaders. This program was, I guess, the brainchild of one of my collaborators and members of the American College of Epidemiology, Ms. Yelena Garina, MS, who's also an employee of CDC within the Division of Analysis and Epidemiology. The views and opinions expressed in this presentation is not a reflection of those from the CDC or the USPHS. Dr. Foster's speaking on behalf of her experiences rather than the behalf of the organizations. Okay, so just an introduction to Dr. Foster. She's a medical epidemiologist for the Center for Global Health, the Division of Global Health Protection, and I guess recently Deputy Director of Programs for the CDC Sierra Leone. I'm sure she'll be able to talk a little bit more about that. She previously served as the lead for hepatitis A, perinatal hepatitis B, perinatal hepatitis C, in the Division of Viral Hepatitis at CDC. And she actually grew up in, I guess, multiple countries as a result of her father being a U.S. Marine helicopter pilot, who I know very well. It's a confidant. He's a recently retired priest in the Episcopal Church, or Anglican for those in England. So she's a pediatrician by training. She completed her undergrad, I guess, initially at Eastern Carolina University. Medical school right here, Eastern Virginia Medical School. We're in Norfolk. Most people think of Virginia Beach, so we're about, 30 minutes west of Virginia Beach. For those who are trying to figure out exactly where Norfolk is, or even worse, where Portsmouth, where I live, is. Dr. Foster completed her pediatric residency at the University of Tennessee Health Science Center and a pediatric infectious disease fellowship at Vanderbilt University before joining the CDC as an Epidemic Intelligence Service Officer, or EIS officer, in 2014. Welcome to the program, Dr. Foster.
Thank you so much. That's glowing. I was like, I've done so much.
That's a perfect statement. Can you share with us, I guess, in a few words about just in general career in epidemiology / or medical epidemiology?
Yeah, sure. So what I do day to day really is outbreak response. That's what I've been responsible for. But careers in epidemiology, you can focus on a wide variety of things. I like to break it down into three main buckets, and this is what I broke it down into when I was joined the CDC as an Epidemic Intelligence Service Officer. You kind of have to look for the programs that you want to work within. So I really wanted to gain applied epidemiologic experience. So that's experience that in the field, on the ground, kind of more than just reading my books. I had gotten my master's in public health at Vanderbilt just prior to going down to CDC. And I really wanted to take what I learned in those books and do applied epidemiology. So when I was thinking about the program that I wanted to get into, I really wanted to do outbreak response. That's, kind of what you see on TV. We're all kind of inundated with it now with the pandemic, but foodborne responses, outbreaks in hepatitis, outbreaks of rotavirus or flu. That really interested me, emergency response and preparedness. So it's just kind of one of those lanes of epidemiology that you can go into. And it's kind of what I was doing in hepatitis mainly. And I'm kind of shifting into what the second bucket is, which is programmatic work. So that's what you see a lot in your global health program. So a big program that most people know is PEPFAR. So we're looking at HIV treatment and prevention, a big program. epidemiology can help you work within programs to work on policy and things like that. And then the last bucket is just large data analysis. And that's what our colleague, Lena Garina, does. So she works with large data sets. She looks at the data, and from that data, she can inform people on the ground like me who are more involved with outbreak response or maybe policy, programmatic work to inform what our interventions are going to be. Are these vaccines going to the right people? Are they being distributed in the right places where they're needed versus places that may not need them? So those are the three large buckets that I think of when I think about epidemiology. And I was really working in the outbreak response arena with my hepatitis work. I'm kind of transitioned into more programmatic work with the
particular experiences here at EVA, Direction of Epidemiology.
You know, I was thinking about that in preparation for this interview, and I am ashamed to say that, like, no, like I was really, you know, I came into medicine. I'm very much probably too influenced by pop culture when it comes to thinking about what I want to do with my life. So I am the first medical doctor in my family, and I really, saw programs on TV, like medical programs. It seemed like a great job. Pediatrics really did seem like something that would fit with me. I really like taking care of kids. They're pretty resilient. I know we're using that term a lot these days, resiliency, but they really, really are. And when I was in medical school, I was really concentrating on just being a doctor and learning what it was to be a doctor. I was interested in infectious diseases, and I had read about the history of the HIV epidemic, pandemic, and the importance of CDC and EIS officers when that was discovered, and kind of thought of that, but it was kind of a dream job. It was kind of distant. I didn't really know how you got into that space and didn't really think about it until I did my fellowship in infectious diseases, and that a lot of happy coincidences and hard work led me to the CDC. So a long roundabout way to answer your question is that during medical school, I was just concentrating on graduating from medical school. You know, I had a rough first years, but really shown my clinical years, my third and fourth years, and was really concentrating on being like the best doctor I could be and learning as much as I could to be my foundation for residency.
Oh, excellent.
Mm-hmm.
We mentioned in the introduction that your father traveled extensively with him throughout many countries or so. So any of those particular experiences motivate you also? Can you think of any particular experience whereby any particular country which stands out in terms of the lack of some basic service which we take advantage of?
No. Well, and that just is because of the countries that we lived in were Germany, Japan. So, you know, every healthcare system is a little bit different. And then I was, younger then too. I don't think that I was probably paying attention as much as I should have. But I will say that experience growing up that way has made me become very adaptable and flexible. And that is something that you need in public health, or at least in the public health work that I do. You have to be very adaptable. You have to be very flexible. The phrase, that's not my job is not in anyone's job description. You do what you have to do, whether that is like hand inputting data or being I don't want to say data monkey, but putting data into your spreadsheets, even though you say, well, I'm a big bad doctor and I'm the subject matter expert on this. We all do what we have to do to, help the population. So I think that growing up the way that I did make me very flexible, like I said, and very adaptable. And I'm very quick to be able to get to work.
Great. Okay.
Yeah.
We see that you obtained your master's in public health after medical school.
I did.
And I guess, there are some programs whereby the MPH more or less complements the MD or the terminal degree for clinicians per se, whereby provides them, let's say, for grant writing in terms of application for, let's say, grants, NIH grants, and some things of that nature.
Yes.
So was that one of the reasons why you actually went ahead and obtained your MPH?
Yes, when I was at Vanderbilt doing my pediatric infectious disease fellowship, I was actually on an NIH training grant. So there's training grants called T32s. It's very, it can get very dry and boring, but I was on a training grant through the NIH, and Vanderbilt was a great place full of physician scientists. So there's clinician educators and there's physician scientists, and physician scientists really, they run their own labs, they write grants, and it was a great experience for me to be in that and to see that coming from where I did my residency in Memphis, which has a lot of physician scientists as well. But in residency, you know, again, like when I was in medical school, I'm just concentrating on being the best pediatrician I can be. So I'm very heavy into my clinical education. So fellowship, where we still got that clinical aspect. Vanderbilt was a unique place to learn a lot about that side, grant writing and seeing how to run a lab and how to be a clinician at the same time and how to write papers and research. I was offered the opportunity to get the MPH through that training grant and really took it because I wanted to be able to, if I took the physician scientist track, really understand the research. And I would say that my public health degree not only informed me as far as public health, but it made me a better scientific writer. It made me understand manuscripts better. Like I thought I understood how to read a medical manuscript before I did my MPH and how to analyze data. But when you take a biostatistics course and you get that degree, you really understand what that data is telling you. And you can really discern between a well-written paper and well-written study design and study execution. And I think that my master's in public health really helped with that aspect of it. Again, that was the first time that I was doing something at the same time. So I got my master's in public health at the same time as I was doing my pediatric infectious disease fellowship. And it kind of just goes back to what I said earlier, that usually I'm just concentrating on being the best whatever I can be during that time. But it really was a compliment to my fellowship, I would say.
Excellent. Mm-hmm. I'm sure online we've got students who are MS levels, or individuals are MS level, mm-hmm. PhD level, and are PhD level with several years of experience.
Yes.
In terms of the, I guess, epidemiology in general. We consider ourselves, I guess, not necessarily always appreciated or less appreciated or so. But can you talk about, the use of the needs of epidemiologists in various settings, not just academia or so, but based upon your experiences?
I'm very lucky in that I work for, I kind of work for two organizations, the CDC and the United States Public Health Service, that are very diverse as far as background. So when I came to CDC as an EIS officer, the EIS program, to become part of that program, I think that today is the day for all the applications to be in for this cycle. Not to promote that EIS program, they've not paid me any money, but the EIS program, you have to have a doctorate level degree to apply, but it does not have to be a medical degree. So we call ourselves classes. So my incoming class of 2014 was full of PhD epidemiologists, was environmental health officers, nurses, and I would tell people who are very clinically focused to think that only clinical or people with public health degrees can do things like go on outbreaks and things like that, that my colleagues who have these diverse backgrounds, we were doing the same thing. And as far as data analysis, I am completely impressed by PhD EPI's level of looking at especially large sets of data and providing their views. So I think that I've been very lucky that in that program, that applied epidemiology training program of EIS, you've got the diverse backgrounds, but everybody has an epidemiology background, even though they have different clinical backgrounds or no clinical background at all when it comes to the PhD EPIs. The United States Public Health Service, I'll also plug that a little bit. You guys can Google it. Is also very diverse. There are doctors, but there are environmental health officers, there are nurses, there are pharmacists, but we are a public health agency. It's in our name. So we very much respond to the needs of the nation as far as it comes to global health securities or national public health threats. But with that, I think the diversity of the Corps not just being a bunch of medical doctors, helps us be able to respond and helps us to, really rise to our mission.
Great.
Mm-hmm.
So what would you consider the things which keep you up late at night or cause you to get up early or so? I know you mentioned.
I guess it's already happened. The pandemic, we're already living it. So just, a pandemic that is global in nature and just something that we all have to live with and deal with. I think that, we're all living this together. So I don't want to rehash what's happened over the last 18 months, 15 months to 18 months, because you guys have lived it just like I have lived it. I think that for us working in public health, it's been a challenge to both respond to the pandemic and live within the pandemic, which I don't think that I would have ever envisioned. Sometimes your creativity can't even comprehend something this big. So just having to respond to an outbreak that is affecting your day-to-day life too, I think has been a challenge. And I think that we're coming out of it. I just personally feel like we're coming out of it, at least here in Norfolk, Virginia, as we sit here in the United States. I don't want to speak for other areas globally, but I would say that this kind of thing that's happened over the last 18 months is the kind of thing that keeps me up at night. But I think that now that we've experienced it, hopefully we'll have a lot of lessons learned and we'll look at our what we did really well and what we could do better and use that for the next time, because unfortunately there will be a next time. That this is just how things go when it comes to infectious diseases or other aspects of public health. The whole point of public health and being a public health professional is that we are taking care of populations. So a little bit different from our MD sides. If you are a clinician, where you're focused more on the patient, you're focused on the population. So even when it's not things like coronavirus or big, large outbreaks, we still have to think about obesity and smoking and cancers and things like that. So all those things keep me up at night, but I feel a little bit better the older I get and the more experience I get about we can learn how to respond to these things.
Great.
Yeah.
What would you consider one of your most memorable, let's say, our experience, CONUS or even CONUS?
Oh my gosh.
Either epidemic or, pandemic or so.
I mean, I've been really lucky enough to go into the field many times. I just like any experience that brings me back to being a pediatrician, and it doesn't even have to be kids, but like I do miss being at the bedside and being able to offer an answer for what is ailing someone or relief to what is ailing someone, and kind of linking to what I just discussed about public health being more on a population level, being able to bring something like vaccines and saying this is kind of what is quote unquote ailing the population and this is what will make it better is something that I appreciate. Like there's just too many stories like that. And my previous work was in hepatitis A, which is a vaccine preventable disease and also causes outbreaks and a lot of morbidity and mortality around the world. So it was a very interesting virus in that you could see it with foodborne outbreaks. You could see it in outbreaks that affect vulnerable populations like people who use drugs or people experiencing homelessness. You could see it in waterborne outbreaks. You could see it in children sometimes, but you can also look at the vaccine preventable aspect where if you get the vaccine to the right people, you won't see outbreaks like this. So I don't know, like anything related to hepatitis A or anything going into the field has been very memorable, but memorable in the fact that if it links back to my kind of clinician nature, where I feel like my intervention is kind of aiding the population being like the patient, if that makes sense, if that metaphor translates. I'm not sure that it does.
Okay. For let's say, what I guess specifically our MPH related our skills, let's say, have you used with the pandemic?
Oh, I would say that most of my MPH related skills that are different from my MD skills come with data analysis, being able to look at data and being able to see what the data is telling me fairly quickly that I don't think that I would have been able to do if I don't want to say just an MD for all my fellow medical doctors out there, but I do think that MPH allows me to be able to see data in a way that makes me say, okay, this is a point source outbreak, and we need to worry about food or water, or this is a endemic, whatever it is, it's endemic, it's in the population, or I can look at an epi curve and say, okay, this is where the vaccines started and this is that drop off. So I think that that's where my MPH skills come into play that are a little different from my medical skills. I use my medical skills to, chart review and things like that. So I like that both kind of complement each other in what I do.
Okay. So was that, I guess, a plug for SAS?
I can't, I'm glad we gave the disclaimer in the beginning. And I will say, true to my Vanderbilt roots, I did not train on SAS. I trained on Stata.
Okay.
So I'm not endorsing any biostatistical program.
That's fine. Well, as a pediatrician, the term, in addition to ACE, we used the term earlier representing the organization. My colleague and I are affiliated with American College of Epidemiology, but also ACE represents, advanced or adverse childhood experiences.
Yes.
So can you say any particular, diseases or so or concerns that you have regarding let's say, the pandemic and let's say future or, chronic diseases or so?
Just like everyone else, I think I worry most about everyone's mental health. Everyone's, not just children. Again, I don't want to overuse the word resilient and also don't want to use the term resiliency in a way that says that implies that children will bounce back from this any easier than the adults will. But I think like most people, I'm worried about, the isolation that we all kind of went through, the trauma of just being in a pandemic that we all went through and how scary it was, worrying about our family members and our friends. So I think that worries me as far as long-term effects of going through this as a community, as a global community, as a national community. I would think that would be my main worry, and just kind of it makes me hopeful that I'm obviously not the only one thinking about this. I read stories both in the media and within the scientific community about this, so it's clear that a lot of people are thinking about it, and hopefully a lot of people are coming up with ideas on what we can do about it. Just like the overdose deaths going up, things like that. I think that hindsight is always 20/20, but I worry that we'll look back and we'll see things that we didn't think were related to this time period that actually were related. And obviously it's going to take some time to see that, retrospective studies and all kinds of things like that.
Right. So you mentioned, I guess, the literature. So you actually read up on.
I read. I don't know. I don't know if it's just. I don't know why I said it. Obviously, but I'm not sure if other MDs do. But I do think that most doctors I know keep on top of the literature as best they can. Again, there's a lot of literature out there. I feel like every day I'm getting an email about a new journal that's being started, and it's hard to kind of discern which journals are going to good ones. I mean, we have impact factors that we can look at, but you kind of have to think about who calculates impact factors, like where do those come from? I mean, I'm not going to claim to be an expert in publishing or how people get papers out and access to papers and open forums and things like that. But I try to keep up to date, both in my field of study and definitely if I come across an article with a title that interests me, whether it's public health or virology or infectious disease or pediatrics, I will take a glance to see if the study design was good, to see if it was worth talking about. to see if it's worth knowing. So I try to keep up on my reading, but it is hard. It is a bit of drinking from a fire hose if you think about it. There's just so much out there. So I just try to keep a routine about it. And I'm just naturally curious. I think probably a lot of you are.
So often students applying to the MPH program state that, hey, after they graduate, they'd like to go to work for the CDC.
Yeah.
So I'm assuming most cases, CDC is primarily hiring individuals with PhDs primarily for the most part. Are there many programs for master's level, and particularly MPH program students?
Yeah, so I can't say. We do have a lot of folks with MPHs that work as public health analysts and public health advisors. So I was looking up again. I came to the CDC through the Epidemic Intelligence Service. So that was the route that I took, which again requires a doctoral level degree to apply. So unfortunately, I can't really speak to other ways to apply to work at the CDC. I know that jobs are listed on USA Jobs, but I'm sure a lot of you guys already know that out there. But if you don't have a doctoral level degree, that's where I would go. There's a lot of, not a lot, but there are also fellowship programs. I don't know how the pandemic has impacted them, but I know there's different fellowship programs that you can do that are at very varying lengths. Some are like a year, elective programs. So I would look into that too if you're interested about jobs at the CDC. I just went to the CDC in a very specialized way, so I wish I could offer more advice on that end, but yeah, I don't know the details.
That's fine. That's good. Again, that's usually a common statement in the biographical statement for our students. Everyone wants to go to the CDC and realize that there are other branches of the CDC which are outside of Atlanta, like our colleague, Maryland, I guess DC area, where Lena is located or so. Okay. And I guess any advice, not necessarily any advice, but if anything, or in terms of the MPH program for the students who are in MPH program, they're wanting to know exactly what course, I guess, sticks out as not necessarily the most informative beyond the stats, or something which I guess you can look back, if there's any, which really said, hey, that really helped me, and I'm so glad I took this particular course.
Biostatistics. Okay. Oh my goodness. And I think that I just had a good teacher, but it really did make me look at the data in a different way, and it really did make me think of things in a different way. Just being able to analyze the data myself and being able to look at the data and the different study designs. I think that it really stood apart from the classes that I took in medical school and the lessons I learned in the hospital as a resident or even as a fellow. I think that biostatistics, I'm not going to say when I graduated. You guys can look that up.
Oh, okay.
But I'm not sure how much biostatistics is integrated into clinical education now. It might be more integrated than when I came through, so I don't want to comment and say that you can't get that, but it's definitely something I did not get as I went through my clinical training. So I would say biostats.
Okay, all right. You mentioned that you're getting ready to head out to our Sierra Leone. So are you excited?
I'm excited.
I don't know, can you talk about your job in terms of what you'll be doing?
It's just helping the country itself build their public health capacity. CDC has offices all over the world that helps build capacity in different countries. So hopefully I'll help the CDC office there to do that. I can't speak on specifics. I'm not over there yet, but I'm very excited to get over there as soon as possible. So hopefully it'll be within the month or so.
Good. So joining the USPHS, I guess, wasn't necessarily based upon your father's military experience, because
that helped. He was very proud. If he's watching, he was very proud to see one of his children in uniform. We are a uniform service. We are non-militarized uniform service. So there are 7 uniforms. Oh, now 8 with the Space Force. There are 8 uniform services in the United States, of which the United States Public Health Service is one. And again, I applied for and went into the USPHS through the CDC and the EIS program. So that was kind of linked. You can apply to the Public Health Service, obviously with not working for the CDC and not working as an EIS officer. And I encourage you all to look into that. Pride in Service. You can look up the United States Public Health Service to see the requirements and what they're looking for. Again, it's a diversity of backgrounds. So, but that's very strong public health work really across the nation.
Okay. I believe we have a question from the audience.
Oh.
Okay. There we go.
Oh, Mujdi. I don't want to say your name. I apologize. But what type of soft skills have helped you most in your career path? Oh, that's a great question. I do think that soft skills, as far as it always makes me think of diplomacy, and it's something I was talking about with my father yesterday. Just, soft diplomacy. The skills that you really need are communication skills. You have to be a good communicator, and that's whether it's in oral presentations or in your scientific writing. I don't think that, I mean, I don't want to say no one's a master at communication, but I do think it's something that you have to continue to work on. I continue to work at being a better writer, and I choose to review manuscripts for journals. Whenever they send me a request, I always accept, because I know that doing the review will make me a better writer. So, and it also helps me keep up with my reading, my manuscript reading. So things like that. Make sure that you're always working on your communication skills, as far as written scientific communication skills and your oral communication skills, presentation. Vanderbilt in the pediatric infectious disease program, they like presentations a certain way, but it was really helpful. Like during the time, I'm like, oh, why do I have to use Arial font? Why is it 6 lines a slide? Why can't I put pictures and do? But it's very important when you see a quote unquote bad presentation that has good data and good science, but you're distracted by all the pictures and the color and the wrong font. It can really impact what you're trying to communicate, and what you're trying to communicate is the science and the data. So I just took another best way to present data webinar on Tuesday. So just always keep those skills up, and always, and there's always new things out there. Like I joke, the people who trained me when I was a fellow were talking about how they had to give their Monday morning presentations in the old slide deck where they're putting their slides in one by one and clicking. And I was lucky enough to have PowerPoint. Yes. And now we're all in this era of working from home and these new technologies that people work together that I don't even understand. So you kind of just have to keep those skills up as well. So I would say that communication is the biggest quote unquote soft skill. And that's something that I continuously work on. And I think that good communicators will also continue to work on, because you can always get better.
What about the knowledge of another language, a second language?
Oh yeah, that's always helpful. I wish I had, it's all very helpful, especially when you're doing global travel. I am, French would be the other language that I go to, but I have not kept up with it as well as I should have. I can read it, so it helps me. I can read articles in French if I need to. I could probably get around in French-speaking countries if I needed to. I'd feel a little uncomfortable if I had to present in French. So having multiple language is always helpful for a variety of reasons.
Excellent. I believe we have another question from the audience. Okay.
Yeah, what does it take? Sorry, I should read the question out. Thank you, Dr. Foster. What does it take to work with the CDC? Again, I'm learning this the older I get, is that we all have ideas of what we want our careers to look like. And I will say that the only person who's going to protect and guide your career ultimately is you. Obviously, it's good to have great mentors and find mentors that are on every level. Peer mentors of folks that are equal to you in your stage of training. And then, of course, mentors who have varying levels of experience above you. And then become a mentor yourself, because it can show you what if you get a good mentor and you are a mentor, it can kind of show you the blind spots of what you could do better in your own career, trying to mentor someone else. So mentors are very, very important. But that being said, you direct the path that your career is going to take. I wish I could give you a formula that says like, this is how you get to work at the CDC. And, but like I said earlier, when I was in medical school, that was not even a thought. Like I knew about it. And to me, it was just something that was so aspirational that it was beyond comprehension almost. Like I knew that job was out there, but it was like, oh, I don't even know how you would begin to do that. So I say that just to communicate that concentrate on small steps in directing your career the way you want it to go, and you'll end up where you're supposed to be. Like I ended up at Vanderbilt because I wanted to do pediatric infectious diseases, and I chose pediatrics because I wanted to be a pediatrician, as I explained earlier. That's why I really went into medicine. I did infectious diseases because I'm one of those weird people who is both a generalist and a specialist. So I like to know a lot about a few things, but I also like to be really, really generalized. So I chose infectious disease because it interests me, one, and two, because I wasn't limiting myself to a particular organ within a body. Like I was still taking care of the whole child, but I got to be a subspecialist. But if I had not gone to Vanderbilt to do my infectious disease training, I wouldn't have had the opportunity to get that master's in public health. And it was through the public health program and my teachers there who had done EIS at CDC who are like, you would be perfect, you have to apply. So again, that just goes to show you that I was just trying to be the best pediatrician I could be. And then I was just trying to be the best pediatric infectious disease doctor I could be. And that ended up leading me to the CDC through my mentors. So I would just concentrate on whatever stage you're in right now, just being the best, whatever that stage is that you can be. Get some good mentors around you, watch programs like this so you can get some background and ideas and make connections and network and treat your career that way. And you'll find that if you do it like that, that you'll be happy whether you're working for the CDC, a local health department, WHO, whoever, as long as you get to use those skills that you've acquired, I think is the goal.
Excellent. You've already stated that you would prefer not to discuss exactly when you graduated. Is this your first time coming back to campus?
Oh, I've been back. I think I've driven by campus.
Okay.
I will say that I did medical school where my parents live in Hampton Roads area. So Dr. Campbell's already explained kind of Virginia Beach and this area in Virginia. So when I come back to see my parents, if I'm over on this side of the water, then I will drive by just to see what campus looks like. But I graduated in 2007.
Oh, okay.
And I will say that campus is beautiful. There's this is a new building that we're sitting in. It's probably not new anymore, but it's new to me. And it's just amazing to see just how things have changed and grown.
Okay, great. All right. Any other questions from the audience?
Okay, so the next question is, how about making relationships, or partnership with employees or other colleagues at different agencies? Is it helpful? Yes, extraordinarily helpful. And again, I've just been really, really lucky being a member of the United States Public Health Service, in that the members of the United States Public Health Service work for various agencies around the nation. So there are, another name for us is Commission Corps. So there are Commission Corps members not only at CDC, but at the Food and Drug Administration, at the NIH, at the Indian Health Service. They can be seconded, so work for other agencies kind of within the broader U.S. government. And I will say that it's extraordinarily important that I am able to make connections to other Corps officers who work at different federal agencies. If there's an outbreak of hepatitis A impacting the Bureau of Prisons, then I have contacts in the Bureau of Prisons. And maybe it's through your work that you gain these contacts. with people who work at other agencies, but I would say that it's extraordinarily helpful. Just doing deployments where we all get together from various agencies for a common goal. I mean, we always have the common mission, but when you're in a smaller deployment for a common goal, to talk to my FDA colleagues, my NIH colleagues, or even my colleagues at the CDC who work at offices outside of Atlanta, just to see how their experiences go and network with them has been invaluable. Like learning about what other job opportunities are at their agencies that might fit your skill. Maybe you're looking for a little bit of a change, and maybe you're not even looking for a little bit of a change, not when you meet that person, but years down the road, you think back, oh man, maybe I could do some work for the FDA. Oh, I remember so-and-so who I met during that outbreak that time or during that conference. So I would say, whenever you meet someone from a different agency, usually it's at conferences, and I love to go to conferences. I mean, even online it's helpful, but it was better when everything was in person. Not only to learn a lot of things, it's like being able to read 100 journal articles at once. You just go to all the sessions, but also to network, to see friends that I used to train with that maybe have moved to other places around the nation that I don't get to see frequently, but really to meet people and network is what those conferences should be used for. And hopefully they'll start again soon. But all that to say that it is very important to make relationships and work with people from other agencies if you are given that chance.
Great. Is there another question?
Oh, wow.
Yes. Okay.
Jamila Tolliver. How is your work-life balance working for the Corps? I want to serve and have a family. That is a good question. So it is not too personal. Thanks for asking. And I think work-life balance is very, very important. As someone who has trouble threading that line, like Dr. Campbell knows, today is my day off, and that's how I'm able to talk with you all and visit my parents. But of course I was like on a conference call as I walked into his office. So sometimes it is difficult because, the work doesn't always stop. I am married. I have a husband. We do not have any children. And I'm lucky enough to have a partner who's very supportive. And in our grand schemes of moving to West Africa or understanding that I have to be deployed for a month, to help out with an outbreak. So I'm very lucky in that I have a partner who is really supportive and understanding when it comes to my work obligations. And he's also a good check on me checking my email at dinner time. So I think that it's very good to have someone who helps you monitor your work-life balance if you are someone like me who can kind of get into a gray area where they are not taking time for themselves. Because really, if you are not rested and recovering and at your best, you're not going to be able to do that work that you're so passionate about. I would say in the Corps, we are a smaller uniform service that has a lot of responsibility. It's a lot of responsibility to protect the health of the entire nation. So it is something that you will have to think about. We do go on deployments for weeks at a time away from our families if the need arises. So it is something that you would have to consider. But I would start by, I think that they put my LinkedIn information in the chat. I would start by talking to other officers to see their perspective. I can't give you the perspective of what it's like to be an officer if you have children, to have to deploy at a moment's notice away from them. So I would try to get the varying perspectives, and you can message me as well if you have questions.
Is there a PT requirement?
Yes. So we have a physical. Yes, we have weight standards. We have physical requirements. So we have to do an annual physical fitness test every year to make sure we're maintaining those standards. So we are ready for any kind of deployment that we have to undertake. So yeah, there is.
Is there another question?
Oh, we can't hear you.
Yes, I would say I really appreciate the discussion so far. And I have two questions for you. Yeah, so the first question, I would like to know, How do you deal with failures all through your careers? You've had perhaps some failures. How do you deal with that?
Yeah, sorry, Marius, you may have to type it in.
You're breaking
up. We definitely want to hear your question.
All right, so I will just repeat it while typing.
Just type it in the chat box.
All right.
Okay. Are there other questions? Okay, while he's typing, Dr. Foster, any words?
Oh, no. It's going so well.
Okay.
Oh,
let's see.
Okay. Oh, sorry about that. I hope everybody can see us. It says that you guys can see us.
Can you hear us now?
Yes. Hello. Can you hear me now?
Oh, Marius, you're still breaking up.
Yeah.
Sorry. Okay, so I just typed the question. If you can get it on the chat.
Nope, still breaking up.
Oh my God.
I guess to answer your question before we were interrupted, I don't know if the audience heard that Dr. Campbell was asking me for any words of wisdom. And all I can say is that, there's the challenges. Oh, this is a great question. How do you deal with failures? I was kind of just getting to that. There's going to be challenging times, and only in looking back do you realize that those times were really to help you grow. And I don't say that to sound like, a Hallmark card or anything like that, but truly I was really challenged my first couple of years in medical school. Like I had to, thank goodness I had good teachers that saw how hard I was working and how hard I was trying to get me to that clinical time in our third and fourth year, where I really, like I said, I just shined better at that time, just being at the books and just, the stress of trying to get those tests done was a little too much for me. But looking back on that, everything that you go through leads you to where you are. And I'm at a great place now, even when I'm in the midst of large outbreaks and it's just like, oh my gosh, like, don't they understand that it's not just me? Can't somebody else work on this? I just want to go have dinner with my husband. Those are the times that you'll look back on it and see, even though that was challenging, even though maybe I didn't do the best that I could have done in that situation, I know better for next time. And you really just have to hold on to that nugget that next time you will be better, and just forgive yourself. And that's what I do when I have a mini failure or I feel like I'm not at my best. Something we would say when we were on call, and I don't even think they do, I'm just going to tell my age. Like we used to do, like I sound like the old doctors, like I was on call every other night for like 80 hours. So when we were doing overnight call, what you say to yourself to get through that overnight call where you're working for 36 hours straight is time doesn't stop. It doesn't. The time doesn't stop. So if you're in a rough patch now, or whenever I'm in a rough patch, I just go, time doesn't stop. You'll get through it. You're not going to be stuck there forever. And that's what you just have to remind yourself.
Great.
Okay, we've got another. Oh, it's Marius. So he typed in his question in the chat box. What are some leadership qualities that an epidemiologist needs? Oh, that's a great question. I think I would go back to communication. And I think that we've kind of seen that a little bit in the pandemic. Like if you can't successfully communicate your data or what it is you're trying to, your interventions, what policy you're trying to make, then it's kind of like all that work you did is almost for naught. So I kind of think that a big part of your leadership is going to be being able to be a good communicator and always working on your communication and how to improve that, because it can always be improved in my humble opinion. I would say being able to mentor people, taking the lessons you learned, whether it's lessons you learned during the good times or the failures, as we just spoke about. You don't want people to go through a hard time that can be prevented that you learn from. So if I did something that, it was awful, and I learned from it, and I see somebody making that same mistake, then you tell them what you learned, and you can help them that way. I think that's the kind of thing that makes a good leader. Service and your job, just by definition, is service. You're helping the health of a population, and service is very important to leadership. So those are all the qualities that I look for in a leader: a good communicator, someone who's a good mentor, and someone who really is serving their community and even their team that they're working with or leading.
Great, thank you. I believe there aren't any other questions or so, but I'd like to thank all participants. I'd like to thank the individuals of public health in real life, our Ashwin, who's my former TA and former student, Dr. Alexa Adima, Marius, and others who are really put this together. Again, many thanks. Dr. Maymunat, would you like to close us out now?
I said, wow, this has been a very insightful session. Thank you so much, the team at EVMS. Thank you so much for just sharing your insight, your experiences. And I know you had a lot of really funny anecdotes of your experience with your father being in the military and how that shaped you, your struggles during medical school. But I think your candor with really sharing your passion, your experiences, what has helped you, what you struggled with, has been the most informative for our audience today. So for anyone watching today's episode of Public Health in Real Life, we focus on a career path to epidemiology. And we've just had the very, very delightful Dr. Monique Foster sharing her experiences with us from her background in medicine, pediatrics, and her journey so far into public health and epidemiology. Please feel free to connect with us on our different social media handles. Please like and subscribe to our channel. Before we leave, Dr. Foster, if any of our panelists, I think we lost Dr. Foster on the stream. She had shared her LinkedIn details, so please feel free to reach out to her with any questions, any comments, or any need for information. Once again, thank you all for joining us, and please stay safe and be well. Bye.